patient has left anterior canalithiasis. This is when the otoconia become dislodged from the utricle and end up floating in the endolymph of the canal. This inappropriately stimulates that canal. Canalithiasis is a form of benign paroxysmal positional vertigo that is typically caused by changes in position and described as a spinning sensation that lasts less than 1 minute.
Hi, my name is Clare Swietlik. I'll be your student physical therapist today. Can I just get a name and date of birth, please?
I'm Tori, Stanzeski, January 21st, blah, blah, blah.
Okay, thank you. So today I'm just going to be running through some tests to see if we can find out where your dizziness is coming from. Is that okay? Okay, sounds good.
For the following tests, we are assessing extraocular eye movements in order to rule out central or acute peripheral deficits. For the spontaneous nystagmus and the gaze-holding nystagmus clips, we are assessing for nystagmus. For the smooth pursuit clip, we are assessing the quality of the eye movements, so we're looking for saccadic interruptions or jerky eye movements, also known as cogwheeling. For the saccadic eye movement clip, we're looking at velocity, accuracy, disconjugate motions, and latency of the eye motions. With left anterior canalithiasis, you would expect all of these tests to be negative.
Okay, so for this one, I'm going to be holding this pen out here. I just want you to focus on the cap, and I'm just going to be stabilizing your head, okay? Okay. For this one, I'm still going to be stabilizing you here. Put your head down a little, and I just want you to keep following the pen cap. So for this one, it's going to be the same thing. I'm going to stabilize your head, tilt down a little, and just follow the pen cap. Okay, so for this one, you're going to be looking again at the pen. I'm going to stabilize your head. You're going to look between the pen and my nose. Pen, nose, pen, nose, pen, nose. Good. Pen, nose, pen, nose, pen, nose, pen, nose, and pen, nose, pen, nose, pen, nose, pen, nose.
When testing the vestibular ocular reflex, the examiner will be looking for how well a patient can keep their gaze on a target. During the head thrust, the side the head is being thrust towards is the testing side. The PT will observe for nystagmus during this test. Positive test is a peripheral vestibular sign that indicates unilateral vestibular loss. In our case of left anterior canalithiasis, we expect this test to be negative.
Okay, so for this one, I'm just going to be holding your face by your ears like this. I'm going to tilt your head forward, and I'm just going to be moving your head back and forth kind of quickly. And then at one point, I'm just going to bring you off to one side, kind of fast, but it'll still be a small movement, and I'm going to do that to the other side too, okay? Keep your eyes on my nose.
Next, the PT will perform the Dix-Hallpike maneuver. The PT must clear the cervical spine for any pain or limitations. Then the maneuver could be performed. The PT will maintain the patient's head position and will observe for 30 to 60 seconds for any nystagmus. The suspected non-affected side is performed first to rule out any suspicions. The affected side will then be performed, which in our case is the left. This test will be positive, as we expect to see downbeat left torsional nystagmus.
Okay, so for this one, I'm just going to be holding your head by your ears again. You can grab onto my forearm, and I'm going to bring you back into line with your head off the table a little, but I'll be supporting your head and neck the whole time, okay? I want you to keep your eyes open the whole time, and I'm just going to be looking at your eyes, and you tell me if you have any of your symptoms that you were having earlier, okay? All right, ready? 1, 2, 3. All right, keep your eyes open, and I'm just going to watch for any eye movements, and I'm going to have you hold this for 30 seconds to a minute. We're going to come back up, and then I'll Be looking at your eyes for another 30 seconds to a minute. We're just going to do the same thing on the opposite side, okay? So I'm going to hold your head like this. And on the count of 3, I'm just going to lay you back. Ready? 1, 2, 3. I'm going to hold for 30 seconds to a minute. And come back up. And still watch for 30 seconds to a minute. Good.
The supine roll test is performed to assess the horizontal canal involvement, and the therapist will observe for the direction of the nystagmus. With the patient's diagnosis, the supine roll test should be negative because the horizontal canals would not be involved in this patient.
Okay, so for this one, I'm going to have you lie back. I'll be holding your head, and I'm just going to tilt your head to either side, okay? I want you to keep your eyes open the whole time and tell me if you have any of your symptoms, all right? Okay, so you can lie back, got your head. So keep your eyes open. Bring you to this side. Hold it for up to a minute. Back to the middle. Do you have any of your symptoms?
No.
Okay.
Because the diagnosis is left anterior canalithiasis, the canalith repositioning treatment for the anterior and posterior canals would be performed as an intervention. To begin treatment, the patient will be placed into long sitting to perform the Dix-Hallpike maneuver towards the affected, in our case the left, side for 60 seconds or until symptoms subside. The head will then be kept in some cervical extension while rotated 180 degrees to the other side. The patient will be asked to roll onto their shoulder and side while maintaining their head in the position. The patient will then sit up while keeping their head turned downwards towards the non-affected side. The therapist will observe for reversal of nystagmus once the patient sits up. With our diagnosis, the therapist would expect the nystagmus and symptoms to lessen or dissipate after doing this maneuver. If not completely gone, the maneuver will be done repeatedly over multiple treatment sessions spaced out at a minimum of 48 hours between each session until the symptoms are gone.
Okay, so for your treatment, I'm just going to bring you through the position that you were in earlier, where I bring you back into lying down with your head off the table. This time now, I'm going to have you roll your head around slowly so that you end up on the other side with your chin tucked against your shoulder, okay? And this is just to reorganize those crystals in your ear that might have been dislodged and are causing your symptoms, all right? So I just want you to keep your eyes open the whole time and tell me if you have any symptoms. If you get nauseous, we have a trash can, just let me know, okay? All right, so I'm going to have my hands here, hold on to my forearm, and on the count of 3, you're going to go back, okay? Ready? 1, 2, 3. Keep your eyes open. Now I'm going to come back here. Bring your head to the middle. Keep your eyes open. You're going to hold until your symptoms go away. You feeling okay? Alright, so come to this side. And hold until your symptoms go away. Okay, now I want you to roll onto this shoulder and keep your head in the same position. Okay, good. I'm going to tuck your chin to your shoulder. And I want you to keep your chin there and come up into sitting, okay? I'm going to keep looking at your eyes. Alright, any symptoms?